I'm a happy, laughing person, and so was Robin Williams. He made the whole world laugh, and no one ever suspected that he was anguishing inside. Well, I went through 2 months of really severe depression. I didn't want to eat. All I wanted to do was sleep. I didn't want to get up. I didn't want to work. I didn't want to do things I loved. I didn't want to leave the house. And it was cold and rainy and all these excuses that I made for myself. But finally, I just said, I have to get up and do something. I was looking for a counselor because I was diagnosed in early February of 2018 with stage 4 lung cancer. So, and I was given a pretty grim prognosis, which I have since disproven by living well beyond it. When you're given a diagnosis like that, you begin to think of, okay, what do I need to do? What do I really want to accomplish with my life? What are undone things? And so my daughter is the most important part of my life, and I wanted her to have someone to turn to in dealing with her grief, and also to help me prepare. But the primary objective was, I think that people tend to wait until they are in crisis to begin looking for a counselor.
Yes.
And very often they're told, we can get you in 6 to 7 weeks. And then the person won't make that appointment. And when 6 or 7 weeks they're in a totally different place, doesn't mean they don't still need that. They just may not be in a flaming crisis at that point. So I wanted to establish a relationship to help us both as we approach the end of my life, and to help Leanne in dealing with it afterwards. And I wanted to do it with her because it was really important for me for you to understand the dynamics of our relationship.
Yeah.
And how we live together. Yeah. You know, how we go through our life together. It was important to me to find a Christian counselor because our faith is such a foundation in our life. Yes. That I don't think you can counsel me without looking at what makes me who I am.
I agree.
And that is my faith. And it is for Leanne as well. So Fernview Stress Management was the answer to prayers because there are 8 counselors here. People can choose who is best suited for their need and their personality, who they best relate to. And I called and I was greeted very professionally and nicely by the receptionist. She booked me an appointment very quickly, and it's just a very comfortable place for us to come.
Truly, it feels like a family-oriented place. I mean, it's a place of healing. It's a place where I can be vulnerable and honest and, express my fears for this upcoming chapter of my mother possibly passing way before she's supposed to, and how to deal with that. But you have given us tools on how to focus on today and not worry so much about what's to come, but to share our stories, share our love with other people.
All your advice has been solid, and it's helped us to not only solve current issues that we were going through, but to know how to prevent future similar incidences. We've learned about setting boundaries, even for those we really love, that we have to define what it is that we will allow to affect our spirit. And
beautiful.
And that it's okay to say, I love you, I will always love you, but I don't allow that in my life.
And I also love that here at Fernview, you have many different types of practice. Yoga, Reiki, meditation, You know, you have a labyrinth in the backyard. I saw 2 chairs walking up earlier when we were coming for this session that I had never seen before, and I thought, what a lovely venue to just come out here and just be. You don't have to do anything. You don't have to be anywhere. Just be outside. Just enjoy.
Yeah, the setting is absolutely gorgeous. And it just lowers my blood pressure to look out the window and all I see is green. And I think the color green does that, and especially seeing green in nature. One other thing I'd like to say about this setting, it is unbelievable that this calm, peaceful setting is literally 1 block off Highway 81. It is so convenient to get here, but when you turn in that driveway, you just enter a different, it's like an oasis. And it's just incredible to me that we are so close to the hectic traffic of Anderson, and yet we're here secluded.
Yeah.
So the location is terrific, easy to get to. If you are alive and breathing, you will at some point in your life have at least 1 episode of mental issues, whether it's anxiety, whether it's depression, whether it's just, I'm not a mental health professional, so I don't know all the things. But I know if you have a brain, you can have mental issues.
Yeah.
And there is no shame in that. I'm proud to tell the people that are my friends and that I work with, yes, I have a therapy appointment this week. And they'll always say, they always assume initially that it is medical, a physical treatment. And I'm like, no, this is for my mental health. I'm not afraid to die. I don't want to leave my daughter. And when I was first diagnosed, that was the devastating thought on my mind is, I haven't prepared her for this. You know, I can't leave her, she's not ready. But she's grown so much in her faith over the past 19 months. And this counseling had a large part to do with that, with preparing her and bringing her into her own person, not just my shadow. For example, a year ago, she wouldn't have prayed out loud at our dinner table. And that one question you asked, I think I'm fairly intelligent, had never crossed my mind. But it turned everything 360 degrees. She said, Leon, what are you going to do? What do you plan after this? And it stopped us from focusing on the hurt, which we know is coming, to begin to see you will get through this.
Right.
So then what are you going to do?
Right.
So that was huge. That was huge. One simple question from a professional who knows what to ask to help her patients work on healing their own wounds.
I think that we're giving our family and friends a different perspective since we've been coming here on how they should be looking at their lives and their inevitable demise. And some of the people that we have come across and we've talked to about, oh yes, we go to therapy, we're talking about, pre-grief, potential grief that may happen, how to deal with it, how to stay on top of it. And they just look at us like, I've never even thought of that.
Friends are wonderful, and we all need to cultivate friendships and feed them. Don't just say, oh, I've got this friend, and then ignore it, because it will die if you don't feed it. But I feel that you need someone who is objective, who can look at your situation from outside into your heart instead of from in your heart outward. And that's an important thing that therapy provides that friends can't. When we went to see our my current oncologist, John Doster, which is he is fabulous.
Yes, he is.
And his staff is fabulous. We were sitting in the exam room waiting for him to come in. And we were just being our normal selves. And we got tickled about something, and we were just giggling and giggling, and then we finally stopped just as he pushed the door open. And, we're sitting there like children in the schoolroom.
Like we had gotten caught.
Yes. And he said, "I heard you laughing. It is the most beautiful sound to hear in my office."
Well, I feel like coming to therapy to see you every week, every 2 weeks, has made me understand that death is not, it's not a scary thing. It's just a transition. It's just a chapter in your book. I'm sure that there's people that are going to be behind me when I pass that have to go through this. So it's not the end of the world that my mother may possibly pass away. It's just a chapter. One of the things that you told us when we first started coming here was your goal is not to make this a lifetime thing. You want to equip us with the tools and the knowledge and the confidence to move forward no matter what we're dealing with in life, and how to deal with difficult situations, difficult people, sadness, joyous thing, whatever it is that we're going through, to embrace it and to work through it. And I thought that was, I don't know, just a strong indicator of what a professional and what a caring person you are, and the staff here even. You don't want us to have to come for a lifetime, just like you've told me. Even after this situation, passes or not, in 10 years, if I still need you, you'll still be here.
I know that whatever Leanne faces, will always have this resource. And even if you're not here, if you hit the lottery and retire, my daughter, I've passed on to her the sheer knowledge that therapy is a good thing, and not to be afraid to avail herself of it. And that's what I want others to know. I'm a very logical person, and I've never thought there was a stigma about mental health, but I know that is a prevalent attitude. And I take every opportunity I can to speak out on Facebook, to speak with friends and everything. It is not something to be ashamed of, any more than I should be ashamed of I have blue eyes, or I have a funny hairdo right now. I look like a baby skunk. I'm not ashamed of that. I'm not embarrassed about that. It just is. And I've just fortunately never thought of mental health professionals as someone to avoid, or someone who treats losers or crazy people. And I hope that I've taught my children that.
Yep. People
People need to realize that even good things, even joyous things, can be stressful. And you have to stop and acknowledge that stress, and then reach out for the appropriate avenue to help you manage it.